present with his attorneys, and the prosecutors are present as well. We are outside the presence of the jury, still having some issues with the restroom in one of the jury rooms, so we're dealing with that. Are the parties ready for me to bring the jury in when the jurors are ready?
Your Honor.
Yes, Your Honor.
Okay, great. See if they're ready yet, please. Please be seated, everyone. The record should reflect that the jury's back in the courtroom. You may call your next witness, please, Miss Brady.
Your Honor, we would call Jeremy Leadham.
Good morning. Could I have you raise your right hand for me so that I can administer an oath? You solemnly swear or affirm under penalty of law that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth.
I do.
All right, please be seated. Please tell us your full name and spell your first, middle, and last names.
Jeremiah Leadham, Jeremiah, no middle name, last name Leadem.
Mr. Leadham, can you just pull that microphone? It moves on the table there. If you can just pull it a little bit so everyone can hear you. Thank you. Can you please tell the jury where you worked in November of 2012?
I worked for Action Care Ambulance.
And are you a paramedic?
I am.
Do you recall working on November 13th of 2012?
Vaguely, yes.
And do you recall being dispatched to the Arapahoe County Jail.
I do.
Now, is Action Care Ambulance, is that part of a hospital, or is that a private company, or what is it?
It's a private ambulance company.
Okay. And do they make calls to the Arapahoe County Jail when necessary?
Yes, at the time they were contracted with Arapahoe County Jail to handle any medical transports for their detainees.
All right. When you were dispatched to the Arapahoe County Jail on November 13th of 2012, when you went there, did you know who you were going to pick up?
Upon, not initially with the dispatch, they just gave us patient age and gender, as with most dispatch information. We didn't know who we were there to see until we were greeted by infirmary staff.
And what information were you given once you got to the jail?
Objection, hearsay.
For purposes of medical diagnosis or treatment?
Well, did he do, why don't counsel approach, please? All right, the objection is overruled.
Sir, can you tell the jury what you were told once you got to the jail?
I was told the name of the patient I was picking up, which was Mr. Holmes, and the circumstances which brought us there. They wanted to pretty much just tell us why he was being transported to hospital and give us a brief rundown of his medical history, everything pertinent we needed to know to be able to treat him correctly on the transport over.
And can you tell the jury what information you learned about why they wanted him transported to the hospital?
They stated that on camera they witnessed him voluntarily hold his arms out, fall backward, deny that he struck his head or anything like that, deny any loss of consciousness. After he fell to the ground the first time, he was able to get back up. He got up on top of his bed and then proceeded to do the same motion, arms out, fell backwards. Once again, didn't hit his head, didn't lose consciousness. After which they noticed he started exhibiting combative behavior, became erratic with any of their assessments, and they also noticed a bruise across his forehead. And so out of concern for any possible head injury, they wanted him transported to Denver Health, where they could run more comprehensive CT scans to determine if there was any damage done. And so they needed our ambulance to transport him there.
Did they also tell you he was striking his head against the wall?
I believe so, yes.
When you got into the hospital, can you tell the jury how Mr. Holmes got transported, I'm sorry, I'll start over. When you went into the jail to get Mr. Holmes, can you tell the jury how Mr. Holmes was moved from the jail cell to the ambulance?
So we essentially just brought our stretcher and all our medical equipment to the infirmary. We went to his specific cell. They escorted him out of his cell. He sat down on our stretcher. We buckled him up, rolled him the rest of the way through the jail to our ambulance, and then went on with our transport from there.
And when he was getting up onto the stretcher, were the guards helping him do that?
I believe so, yes.
Did you ride in the back of the ambulance with Mr. Holmes?
I did.
Describe what you observed about Mr. Holmes in the ride to the hospital.
Essentially, I did my best to do my normal assessment as I would do on any traumatic injury patient related to the head. Tried talking to him, tried asking him questions about his condition. He didn't seem real reliable in disclosing what was wrong. He wasn't able to hold a conversation like you and I are right now. I proceeded to ask him to do a couple things so I could rule out possible disease processes that were going on. I had him try to follow commands. I had him repeat phrases, asked him to smile, determine if he had any facial droop. He could do that. Asked him to repeat a phrase to determine if he had any slurred speech. He repeated the phrase, and he would continue to repeat that phrase over and over throughout the transport. But besides that, he wasn't real conversive, pretty much maintained a locked gaze to the ceiling of the ambulance, and if there was any interaction, it seemed to agitate him. So.
Okay. Did you try and find out whether he was oriented at all? Is that something that you do?
Yes.
Can you explain that to the jury, please?
So essentially, if someone has a head injury, we just want to determine how competent and how well functioning their brain is at the time. We just ask some very basic questions like, do you know your name? Do you know where you are? Do you know what month it is? If I had 6 quarters, how much money does that make? All that kind of gives us just a very rough understanding of how their brain is doing. And so anytime you hit your head, we want to kind of evaluate that. So I did ask him those questions. I think at best he was able to tell me his name, but that was the extent of it.
And you said something about having him repeat a phrase. Do you recall what the phrase was?
The phrase is, you can't teach an old dog new tricks. It's pretty much a phrase we just use to see if they can say it without slurring their speech. If they're slurring their speech, we are always concerned about possible brain bleed or stroke. So I had him repeat that phrase. He did with no slurred speech and continued to repeat it on the way in.
So he continued repeating the phrase over and over?
Yes.
I think you mentioned episodes of incoherent speech.
To my rough recollection of that, it was just a jumble words that really weren't appropriate for the conversation, didn't make much sense. I can't remember exactly what he said, or otherwise I may have quoted it, but I don't remember.
Okay. Did you perform any sort of medical treatment during the transport from the jail to the hospital?
Yes, we pretty much just took several sets of vitals on him. That would include everything from blood pressure, pulse checks, pulse oximetry, cardiac monitoring. We initiated an IV for him, gave him fluids because the infirmary staff state that he wasn't eating or drinking for an extended amount of time, so we gave him fluids to take care of any possible dehydration issues. And we drew blood through the IV sites as per our protocol, and no other assessments were rendered. I'm sorry, blood sugar was taken as well.
All right. Any other treatments that you did on the way to the hospital?
No, every treatment we did for him would be in the report I wrote.
All right. Did you see any injuries to his head?
I saw what I believe was an old appearing contusion or bruise across his forehead.
How big was it?
I described it as about the size of a baseball.
Now, which hospital did you take Mr. Holmes to?
Denver Health.
Were you aware what procedure was going to be performed at the hospital?
I believe the infirmary staff told me that he was going in for a CAT scan to be done.
Did you assist in transporting Mr. Holmes from the ambulance to the area where the CAT scan was done?
Yes. We went into Denver Health's Sally Port. There we were escorted. He, once again, was on our bed. We wheeled him into the CAT scan room and helped transfer him over to their bed. They performed the CAT scan. We put him back on our stretcher and waited for the doctor to go over the results.
How did you transport him from your stretcher to the CAT scan bed?
Can I refer to my notes?
If that would help refresh your memory.
Please.
Your Honor, if I can approach.
You may.
Mr. Leadham, does that help refresh your recollection about that?
Yes.
Can you tell the jury, please?
We took the sheet he was lying on. 4 people grabbed the sheet, lifted it up off our stretcher, and glided him over to the CAT scan bed.
And after the CAT scan was over, how did he get back to the stretcher?
Same fashion.
Okay. Do you recall how long the trip was? Like what time you picked him up and what time you dropped him back off at the jail?
Roughly about maybe hour, 20 minutes. All those times would be included in the report.
Would it help to see a copy of your report?
It would.
Okay. Sorry, Your Honor, if I can approach the witness.
Yes.
To go from the Arapahoe County Jail to Denver Health, we arrived at 10:53 and we arrived at Denver Health at 11:58, so an hour and 5 minutes.
And then do you recall what time you got back to the jail?
I believe that's in the report I wrote for the return trip.
All right. Do you have that up there or not?
I do not.
I don't know if I can approach.
Yes.
Is it in that report?
No, it would be on the first page of this report. Looks like we departed the jail at 12:51, we departed Denver Health at 12:51, we arrived at the jail at 13:20, so roughly an hour and 30 minutes.
So 1:20 in the afternoon you got back to the jail?
I'm sorry, no, not an hour and 30 minutes, 30 minutes.
You can keep that one if you need it.
Okay.
Your Honor, I'd also like to approach Mr. Leadham with what's been marked as D-TR-80.
Okay.
Mr. Leadham, does that appear to be a calendar of November 12th, 2012?
Yes.
Would you mind just circling the date it was that you transported Mr. Holmes to the hospital? And what date did you circle?
November 13th.
And if you wouldn't mind, would you write your name at the top and just put Action Care Ambulance? Now, regarding that phrase, "you can't teach an old dog new tricks," you asked Mr. Holmes to state that phrase. Just to be clear for the jury, you didn't ask him to keep repeating that over and over, right?
No.
He just kept repeating it over and over?
Yes.
Okay. Your Honor, I would move to admit D-TR-80.
No objection.
All right, without objection, it is admitted.
Thank you. I have no further questions.
Ms. Teach McGuire, do you have cross-examination?
Yes, sir.
Good morning, Mr. Leadham.
Morning.
Mr. Leadham, fair to say that you never spent any time with the defendant prior to the transport on November 13th of 2012?
No.
And no time after the transport with the defendant, after November 13th of 2012?
No.
So you really had no idea what sort of affect or personality to expect from the defendant when you transported him?
No, I did not.
All right. And the defendant was able to understand some of the commands you gave him. For instance, when you asked the defendant to smile, he was able to do that.
Yes.
And if the sheriff deputies told you that the defendant was actually able to assist himself on getting down the gurney, would that be a fair statement perhaps as well?
I can't remember if that was the case on that day, no.
So you don't really know if he voluntarily did that himself or if he was assisted?
I don't know.
And the defendant only started repeating that phrase once he was asked by you to initially state that phrase?
Yes.
And he had no slurred speech whatsoever?
No.
And you took several tests of the defendant approximately every 10 minutes while you were in the ambulance with the defendant. Isn't that fair to say?
Yes, it's standard of care to check a patient's vitals every 10 minutes.
And all of those vitals came back normal with the exception of the tachycardia. Is that correct?
Yes, he was exhibiting a fast heart rate when we initially got to him. That heart rate dropped to within normal limits sometime during the transfer.
But all the other medical things that you were looking for came back normal at that point in time?
Yes.
And you are not aware of if the defendant is just perhaps not a very talkative person?
I will know that about him.
Now, would it be fair to say that the bruise that you noted on the defendant was not raised in any way, it was just a slight bruise?
From what I described in my documentation, I described it as contusion. Contusion's just a bruise. If it had any elevation, I would describe it more as a hematoma in my documentation.
You were told by hospital personnel that, in fact, the CT scan came back negative.
I wasn't told the results of the CT scan. I was just informed that we could transport him back.
Now, do you recall writing a report about that?
Yes.
If your report stated that you were told that it was negative, would that perhaps refresh your recollection?
You know what? I would have to definitely look through that real quick.
May I approach the witness, Your Honor?
You may. Although I don't think this is a refresh the recollection, I think this is impeachment. He didn't say he didn't remember.
According to the report I wrote at the time, it does say that the CT scan was negative, and the only way I would find out is someone involved in his care would have told me. So,
Would you have described the way the defendant was presenting to you as presenting overly exaggerated?
Objection, speculation, lack of foundation?
I can lay more foundation, Your Honor.
Okay, why don't you lay more foundation? I'll sustain as to lack of foundation for now.
Thanks, Your Honor. You had an opportunity to observe the patient while he was in your ambulance?
For roughly 3 hours, yeah.
For roughly 3 hours. You had an opportunity to observe the way that he was presenting to you at the time?
Yes.
You've had an opportunity to observe many patients over your career as a paramedic, is that fair to say?
Yes.
And from time to time, are you able to determine in your observation as a paramedic whether people appear to exaggerate their symptoms?
Yes, it does happen at times.
Were you able to tell in this circumstance if the defendant appeared to be exaggerating his symptoms as you transported him to the hospital?
Objection, can we approach?
Yes. All right, the objection is sustained, but Ms. Stitch McGuire, you may proceed as we discussed at the bench.
Thank you, Your Honor. Would it be fair to say that you observed the defendant's actions to be deliberate in the ambulance ride?
Objection, speculation.
Sustained.
May I have a moment, Your Honor?
You may.
I have no further questions. Thank you, Your Honor.
All right, thank you. Is there any redirect?
Just very briefly, Mr. Leadham, there was a question about whether you remembered whether anyone assisted Mr. Holmes from the cell to the stretcher. Would you mind checking your notes and see if you noted anything like that in your notes, please?
Okay. What I have documented is that he ambulated with police support from cell to pram, roughly 3 feet, so he did have help from the deputies.
Thank you. No further questions.
Ms. Stitch McGuire, do you have any recross?
Just one question, Your Honor. So the defendant was ambulatory, though, meaning he could walk on his own.
That's what I documented, yes.
Right. Thank you very much.
All right. The jury may have a question for you, sir. Give us a moment, please. Thank you. Would counsel please approach? All right, sir, the jury has submitted a question that, based on the rules of evidence and other applicable rules of law, I have decided is appropriate. The question is, did Mr. Holmes get on the stretcher while in his cell or outside of his cell?
The stretcher was outside his cell.
Are there any follow-up questions, Ms. Brady?
No, sir.
Any follow-up questions from you, Ms. Titch McGuire?
No, thank you, Your Honor.
All right, may this witness be released from his subpoena?
Yes, sir.
Is there any objection?
No, Your Honor.
All right, sir, thank you. Call your next witness, please.
Your Honor, we would call Dr. Elizabeth Loudermilk.
Come around this way, please. Can I have you raise your right hand so that I can administer an oath? You solemnly swear or affirm under penalty of law that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
All right, please be seated.
Thank you.
And can you hand me those pieces of paper?
Yes.
Thank you.
You're welcome.
All right, Ms. Brady, do you want to retrieve these reports?
Yes, please. Thank you.
And Melissa, you want to put that up in your please? Good morning.
Good morning.
Please tell us your full name and spell your first, middle, and last names.
Sure. Elizabeth, Elizabeth, Lyons, Lyons, Duncan, Duncan, Loudermilk, Lowdermilk.
Thank you. All right, you may proceed, Ms. Brady.
Thank you. Good morning.
Good morning.
Can you please tell the jury how you're employed?
I work at Denver Health
Uh,
as a psychiatrist.
At the hospital?
Mm-hmm.
How long have you worked there?
4 years.
And you said that you are a psychiatrist. What do you do at the hospital? Just sort of explain what your usual days look like.
I am the outpatient medical director for the Department of Psychiatry. My clinical work is in integrated care, and a usual part of my work is rotating through being on call when I might be on the inpatient or the hospital side.
All right. Do you have a medical degree?
Yes.
Can you tell the jury just a little bit of your background as far as education towards becoming a psychiatrist?
Yes, I have a Bachelor's of Science that I got in 1994 from Penn State. Unusual for going to medical school, I also have a master's degree in counseling psych. I then went to medical school at the University of Colorado and then completed a residency in psychiatry.
And can you briefly describe for the jury what sort of work you've done in the area of psychiatry?
Psychiatry specifically, okay. I have worked at Denver Health for the majority of my career. During my residency, I did what was called a career year. So I spent a year as an attending psychiatrist at a mental health center. In residency, we spend approximately the first 2 years on the inpatient or consult service. We then transition to more of our outpatient training. I've also was the chief on the inpatient psychiatry for my 4th year of residency, and then followed up with my work at Denver Health.
Okay. Your Honor, if I can approach the witness with D-TR-81, please.
Yes.
Thank you.
Dr. Loudermilk, do you recognize that document?
Yes.
And what is it?
My CV.
Your Honor, I would move to admit D-TR-81, and I would ask that Dr. Loudermilk be qualified as an expert in the field of psychiatry.
Any objection to D-TR-81 being admitted?
No, Your Honor.
All right, without objection, it is admitted. Any objection to the request to qualify Dr. Loudermilk as an expert witness in the field of psychology?
Psychiatry.
Psychiatry.
Psychiatry, excuse me.
No, Your Honor.
All right, without objection and pursuant to Rule 702 of the Colorado Rules of Evidence and the decision in People versus Shrek, which is cited at 22 Pacific 3rd, 68, Colorado 2001, the court accepts Dr. Loudermilk as an expert witness in the field of psychiatry. That means, members of the jury, that Dr. Loudermilk may now render expert opinions in that field. I remind you that you're not bound by the testimony of a witness who testifies as an expert. The credibility of an expert's testimony is to be considered as that of any other witness. You may believe all of an expert witness's testimony, part of it, or none of it. The weight that you give the testimony is entirely your decision. Ms. Brady, you may proceed.
Thank you. Doctor, have you seen a lot of patients suffering from mental illness?
Yes.
And specifically, have you seen patients who suffer from psychosis?
Yes.
Is there any way to estimate how many patients you've seen with psychosis?
It would be in the hundreds.
Did you have an opportunity to meet James Holmes seated here at the defense table?
I did.
Can you explain to the jury the circumstances under which you met Mr. Holmes?
Certainly. I was on call. This would have been Sunday, November 18th, 2012. When we are on call, we see people that are admitted to the inpatient unit as well as people that are on, we're asked to consult on. Mr. Holmes had been admitted to our correctional care medical facility, and the psychiatry department was consulting on him.
How was it that you were called to meet Mr. Holmes?
Me personally or the service?
Let's do both. Start with the service, and then you can explain how you specifically were involved.
Okay. My recollection is that he was brought into the emergency room on Thursday, I believe it was the 15th. He was medically evaluated, then he was transferred for ongoing care into the CCMF unit. At that point, the primary team was our hospitalist, so our medicine service, and they that night called psychiatry to consult. Psychiatry then saw him Thursday night, Friday. Our usual routine is to see somebody with acute symptoms daily. And I, again, was the person on call on Sunday, so I was the one to see him that day.
And when you say acute symptoms, what does that mean?
Sorry, let me take a sip of water.
Sure.
When there are active symptoms, in this case the question was psychotic symptoms, that medications may need to be adjusted daily. There may need to be additional monitoring every day. We will see that person every day.
And we've heard about the team approach at Denver Health. Were you part of the team that sort of rotated through that area?
So on call, we are all part of that team. So I was not part of the regular team Monday through Friday, but again, on call, anybody on will become part of that team.
All right.
So I, for instance, received information from the consult team on Friday and then the person who saw him on Saturday to help with continuity of care.
And when you saw Mr. Holmes on Sunday, November 18th, did you take any notes for the record?
I wrote a note, yes.
Your Honor, if I can approach the witness with D-TR-82.
Yes.
Thank you.
Do you recognize D-TR-82?
I do.
What is it?
The progress note I wrote on Sunday the 18th.
And is all of the handwriting on those pages your handwriting?
Yes.
And did you take those notes on November 18th when you met with Mr. Holmes?
Yes.
Is that part of your regular work as a doctor at Mental Health?
Yes.
At Denver Health?
Yes.
Your Honor, I would move to admit Defense Exhibit 82, please.
Is there any objection to D-TR-82?
Yeah, yeah.
Without objection, it is admitted.
Can you please briefly tell the jury what you observed about Mr. Holmes when you first met him.
When I came into the room, he had recently been up to eat and shower, and he was back in restraints, but I believe he was only in 2 of them. He was.
And can I stop you? What time of day are we talking?
It would have been, I started the note at 10:40, did some chart reviews, so somewhere between 11 and 11:30 I would have been in the room in the morning.
Okay, go ahead.
He was awake, responding to questions. Would you like me to go through a full?
Only if you need that to help refresh your recollection, please feel free to do that.
Okay. He was answering questions. At that point, he was making sense when he answered questions. He was somewhat oriented, so he knew at that point the month and the year. He could not tell me the day or the date. His speech, he was speaking at a normal rate, at a normal volume. He did not appear pressured, which is when somebody speaks very quickly. He had good eye contact. He appeared calm. He was not agitated at that time. He was cooperative. He answered questions. He didn't initiate much conversation. He answered the question asked. He appeared at that time organized. His thoughts, his answers made sense. He did report auditory hallucinations at that time. He reported several voices. One that he described as sounding like it was coming from behind the wall. Just checking. And he had noted or reported that it was hard for him to tell what a real voice was. So what was the voice of somebody talking to him and what was a hallucination. When asked, he told me that the voices did tell him to do things like walk around.
Can I stop you for just a second? So how long had he been in the hospital by this point? Do you recall?
We were going, so Thursday night to Sunday morning, we were going on 3 days.
And what was your understanding at that point as to why Mr. Holmes was at the hospital?
He had what appeared to be 2 main conditions. He appeared to have a psychotic disorder and a delirium that at the day I saw him seemed to be resolving. Based on my review of the chart at that point, it appeared most consistent with somebody who had become psychotic, stopped eating, and become delirious based on that.
And the delirium, is that taken care of by the medical doctors, being, the non-psychiatric doctors?
A little bit of both.
Okay.
So the medical team looks for causes for delirium. Delirium is an acute confusional state that can have multiple causes. So the medical team at that point had already ruled out infection, brain tumor, big things that we know can cause this. Psychiatry often gives recommendations for both the medications to help a delirious state as well as treat a psychotic disorder.
And how did you go about trying to distinguish whether what you were seeing was a delirium or a psychosis or both or neither?
Right. So that's in part based on history and in part based on what's in front of what I saw at that moment. A delirium waxes and wanes.
What does that mean?
There will be times when somebody is very, very confused. They have trouble paying attention, they're disoriented, and then they will have times that they are able to attend to conversation and are more oriented.
How quickly can that cycle between the waxing and the waning?
Minutes to hours.
So 1 minute they may seem okay and the next minute they're completely confused?
Yes.
Okay, go ahead.
So what you look for when you're making the distinction is you look for the times that they don't appear confused and you see how they are. So actually being able to see a time that he was more clear added support to the idea that there was a psychotic disorder there because he was still reporting symptoms.
All right. So by the time you saw him on Sunday, had he been given medication?
Yes.
What was your understanding of what medication he had been given and why?
He started out receiving Haldol, which is used for both delirium and psychosis, as well as lorazepam, which is more used for agitation. He had side effects to those medications, and so the next day on Friday they were changed, and he was on Risperdal, which is an antipsychotic. It's a situation where an antipsychotic can actually treat both delirium and psychosis. So both were being treated.
All right. And so in your opinion, by the time you saw him, was he still suffering from any delirium?
I went back later that day to ask a question of him, and at that point he appeared more confused. So at the earlier moment he was in a clear period, but there was still some delirium going on.
So in the morning on Sunday is when you felt like he was pretty clear?
Correct.
Was it the night or the evening of
The
Sunday?
afternoon, somewhere between 3 and 4, I believe.
All right. And it described for the jury how he was different in the afternoon on Sunday.
He was back in 4-point restraints. It's a minor point.
What does that mean?
All 4 limbs were restrained to the bed.
Okay.
He didn't recognize me. I'm not sure. He actually mentioned not being sure he had his contacts in, so I don't know how clearly he could see me. But he had a delayed response to the questions I asked. He seemed a little more confused. I prompted him with a reminder, we had talked about Risperdal this morning, and he was able to bring back some of the conversation, but he clearly didn't remember all of it. Then there was a delay in his answering that had not been as present in the morning.
Could it be that the delirium was back?
Yes.
What would have caused the delirium to come back?
Number of things. Its natural course, again, is that it will wax and wane, so more symptoms and less symptoms while you're treating it until it's fully gone. It did occur to me that the restraints might be making him more confused as well.
So as of Sunday evening, were you able to form an opinion as to whether you were seeing delirium, psychosis, or both?
I thought I was seeing both.
Okay. What makes you think you were seeing psychosis?
When he was clear Sunday morning, he was continuing to describe psychotic symptoms, and the course of the illness to date seemed consistent with that.
And you mentioned one symptom was the auditory hallucinations.
Mm-hmm.
Why is that significant?
It is one of the primary symptoms associated with a psychotic disorder.
Was he able to tell you how long he had been hearing these voices?
He was not. He was able to indicate to me that they had begun while he was in jail before he was transferred to the hospital.
And did you have any information about whether he stopped eating or drinking at the jail? And if so, why?
There were notes from, I believe, the emergency room in the early notes in the chart that he had stopped eating and drinking in the jail. The why, there were multiple notations of. At one point, there was a note that said the voices had told him to stop eating. His behavior at other points was described as very disorganized, and sometimes when people are very disorganized, I've seen them not be able to make a cup of coffee. When I asked him, he reported that he had, let me just double check my note here.
If that'll help
Yeah.
you remember.
When I saw him, he reported that he hadn't been eating because he had not been hungry or thirsty.
Okay. Was he able to tell you why he was in the hospital, why he thought he was in the hospital?
He said that he had, wait a minute. Sorry, found it. He said he had fallen and hit his head, and said that he had been feeling woozy for approximately a day before falling.
And was that slightly different than what you heard from the jail?
Yes.
What was the difference between what he said and what the jail said?
The jail had reported both hitting his head repeatedly on the wall, and I believe falling off, standing at the bottom of the bed and falling off and hitting his head.
When you saw him on Sunday evening, did he appear paranoid to you at all?
There was, the best I can say is what we call a flavor of that, and that's something, it's just kind of how it looks as opposed to something I could exactly say.
Okay.
But there was a flavor.
And is that something that would cause you to consider psychosis also?
Yes.
Did you change his medication at all?
I did.
And can you explain for the jury why that was?
Yes. So again, in my opinion, I was treating two different things at the same time. I was treating psychosis and I was treating delirium. As I mentioned, an antipsychotic medicine will treat both, but the dosing is different. When you're treating delirium, you use very low doses, and you're really working carefully not to add sedating meds because that can make it worse. When you're treating psychosis, you use higher doses. So my usual practice with Risperdal is 1 to 2 days of 1 milligram twice a day, and then if the symptoms remain present, and they typically are, I will increase it to 2 milligrams twice a day. Because I was balancing the need to treat psychosis with the delirium, I went up by half my usual step. So I increased it to 1 milligram in the morning and 2 milligrams at night.
And that was, your hope was to get to the psychosis with that dosage?
Without worsening the delirium,
Okay.
yes. I also continued lorazepam, and when I think that we only have delirium present, I don't, because that is a sedating medicine that can make people worse. So, but on the flip, it is a medicine that is very good for the agitation you can see with psychosis. So I made a decision to continue that as needed medicine.
All right. Were you given information as to whether Mr. Holmes had received a CAT scan or a CT scan on his head?
Yes.
And why was there a CT scan done?
Two reasons. One, because he had hit his head repeatedly, and two, I believe that the medical team was also looking for causes of the presentation.
And what's your understanding of what the results of the CT scan were?
Unremarkable. It was a normal study.
So tell the jury what they might have been looking for on a CT scan.
A brain tumor would be the most glaring, a bleed, things that take up space in the brain that then can lead to an altered mental status.
Can a CT scan answer the question as to whether someone's mentally ill?
No.
Or psychotic?
No.
Or delirious?
No.
Okay. Did you see any evidence of delusions with Mr. Holmes?
I did not personally.
Do you feel like you had enough conversation with him to where you could be certain that he had no delusions?
No.
What would it take to find out whether someone actually had evidence of delusions?
It would take a more careful questioning, asking about common themes, paranoia, worry about others. I sometimes ask, do you feel safe? Do you feel like people are after you? Do you have any ideas that other people think are funny? You try a couple different ways to get at them, and then sometimes you can, just in letting people talk, they will emerge.
All right. And you did not do that sort of thing with Mr. Holmes?
No.
Can I have a moment, Your Honor?
Yes.
Thank you. Your Honor, I would ask to be able to publish D-TR-82, please. I do have copies.
Okay. Give them to my staff, please.
Thank you.
Do you want to do that now, or do you want to do it after the cross-examination?
I can leave that up to the prosecutor if they want the jury to see the notes first, or I can wait till the end.
Okay. You have a preference?
Probably, I'd prefer to cross first.
Okay. Let's do that then. We'll distribute them after all the questions. Ms. Pearson.
Dr. Loudermilk,
Yes.
now you didn't see the defendant until he'd been in the hospital for 3 days, correct?
Correct.
And the amount of time you spent with him in the morning was 15 or 20 minutes?
Yes.
And then another 5 or so minutes in the afternoon?
Correct.
And you'd never seen him before that date,
Correct.
and you never saw him after that date?
Correct.
So you don't have any knowledge of what his affect or personality or speech patterns are on the regular basis?
Outside of other people's descriptions, no.
And the descriptions you got only related to the last couple of days in the hospital and in the jail, correct?
Correct.
Now, as a psychiatrist, normally when you're trying to determine whether somebody is psychotic or what is causing their behavior, you would do a history, right?
Mm-hmm.
And you need to answer yes for
I'm
the
sorry,
court.
yes.
And in this case, you didn't take a history and find out about his past behavior or learn how he'd been since July 20th in the jail, did you?
There was some history taken, not all of it.
And the history that was taken really only related to the last few days in November, almost 5 months after the date of offense, correct?
To the best of my understanding, yes.
So in terms of how you would normally be trying to assess whether someone is psychotic or whether it is a delirium brought on by not eating, you didn't have that information available to you.
What I didn't have was the amount of time the symptoms were present, which can shape which specific diagnosis it is. You don't need a whole lot of history to determine if someone is psychotic right now. When you try to get more specific with a diagnosis, you need that history.
And you don't know if his symptoms simply came on as a result of having been in jail for almost 5 months, correct?
I don't know when his symptoms came on.
Would you agree that a person being relatively isolated in a jail for 5 months could in fact cause someone to become psychotic?
The way I think about it is there's two things. There's a psychotic disorder and psychotic symptoms. Many things can cause psychotic symptoms. A psychotic disorder will have a particular time course.
And I don't think that was a very good question for me to ask. So in terms of someone developing what you have described as psychotic symptoms, those could occur by virtue of having been in jail for almost 5 months, knowing you're facing possibly the death penalty, and being very isolated.
Objection, compound question.
Overruled?
Correct? That environment could
I
cause
guess
that.
the way that I've been trained to think about it is when psychotic symptoms are present, there is some form of diagnosis. Any stress can result in symptoms.
Okay, any stress, and you would agree it would be very stressful to be in a jail, to be isolated, and to potentially be facing the death penalty.
Yes.
So those are things that could bring on psychotic symptoms.
Correct.
And in fact, that being in that environment could cause a person to decide not to eat or drink anymore, couldn't they?
Yes.
And if you don't eat or drink, the electrolyte and metabolic imbalance can cause you to have delirium.
Correct.
And you could have a delirium and therefore develop psychotic symptoms from that too. Wouldn't that be correct?
Yes.
And without being able to do a complete history and to learn more about how the defendant was and when this came on, you really weren't in a position to determine sort of the chicken and the egg, which came first here.
Correct. Well, actually, let me qualify that. It did seem clear that both were present. I don't know the order of which things developed.
Now, you said that the defendant was reporting auditory hallucinations to you,
Yes,
but you didn't see him responding in any way to any auditory hallucinations, did you?
correct.
And the auditory hallucinations, the only evidence you have that they exist then is simply that he was reporting them, but you didn't see him looking to answer based on what any auditory hallucination appeared to be telling him.
Correct.
He never reported to you any kind of visual hallucinations at any time, did he?
I believe not, no.
And he didn't say that there were any shadows telling him to do anything, nothing like that?
He said the voices told him to do things like walk around.
And when you were speaking with him, though, you said he wasn't agitated or restless, so he wasn't walking around, was he?
He was restrained.
Okay. Did he, in fact, deny having any visual hallucinations?
Let me check my note. Looking at how I have this written, it's not clear to me that I asked specifically.
Okay. But there was never any kind of report about any visual hallucinations?
Not that I recall.
And you didn't see any evidence
To me or in the record?
to you or in the record
There was something in the record in one of the early notes about food or something looking red.
but to you, he didn't report any visual hallucinations,
Correct.
and you certainly didn't see anything that he was doing that would indicate he was having or responding to visual hallucinations.
Correct.
In fact, at the point that you saw him where he had received electrolytes and been hydrated, the delirium seemed to be resolving.
Correct.
He had been sedated over the last few days, correct?
Yes.
And sedating drugs can cause a person to seem somewhat confused
Yes.
and to be slow in their responses.
Mm-hmm. Yes.
Now, it seems that not just you, but there were a variety of different doctors that saw him, and all of them spent a relatively limited amount of time with the defendant. So based on the fact that delirium symptoms wax and wane in a period of minutes, as you said, or to hours, it's also possible that he's waxing and waning at the time that different doctors are seeing him, correct?
Yes.
And because they spend such a limited amount of time with him, they don't see the opposite side of it, whether it's the waning of it.
It's possible.
And it could also then be interpreted as being related to psychosis when it's simply the waxing of the delirium. Wouldn't that be correct?
If all you saw was somebody when they were very delirious, I guess I'm trying to understand that. I'm sorry, I'm not sure I understood the question.
And it may not be a very good question since I'm not a psychiatrist. But if the symptoms of delirium wax and wane, so sometimes they're more present than at other times.
Right.
And you spend a very limited amount of time with the defendant, and you don't see both of those things. You only see one of them.
Right.
And therefore, trying to determine whether or not it's delirium or whether it's actually, and calling it psychosis, it in fact could just be the delirium because that's the only amount of time you saw a defendant, right?
It could be.
One moment.
Okay.
Thank you. I don't have any more questions.
Do you have any redirect, Ms. Brady?
Yes, sir. You were asked a series of questions about whether the stress of being in jail or the stress of being charged with murder, the stress of facing the death penalty could have made Mr. Holmes psychotic, correct?
Yes.
And I just want to make sure the jury understands what you were saying. Can you explain that again about what role can stress play with psychotic symptoms?
Stress can trigger an episode of psychosis, but in the sort of diagnostic language and the way we think of illnesses, there is an illness present.
So there's sort of a dormant, is it fair to say a dormant illness, and then the stress causes it to bloom?
Exacerbate, yes.
Exacerbates it,
Yes.
that's a better word. when considering whether what you saw was a psychosis or not, if you had been given a history that just 5 months prior to this, 2 other psychiatrists were concerned that he was on the verge of a psychotic break, would that have been relevant to your assessment?
Objection, Your Honor. This would be beyond the scope of what she was requested to do.
Sustained.
Your Honor, can we approach?
Yes. All right, the objection is overruled. Ms. Brady, you may proceed.
So I think my question, Doctor, was if you had, as part of the history, that just 5 months prior to that, 2 psychiatrists had suspected Mr. Holmes was on the verge of a psychotic break, would that have been relevant to your assessment?
Yes, it would have suggested that there were either early symptoms or what we call prodromal symptoms that you commonly see early on before you really know what they are or before they declare themselves. and it would have led stronger support to a psychotic diagnosis.
If you had, as part of your history, that Mr. Holmes came from a biological lineage of other folks who had psychosis, would that be something that would be relevant to your assessment?
It would have been considered a risk factor for the development of psychosis.
Why is that?
We know that it's at least in part a hereditary illness.
If you were aware of rambling philosophical writings done by Mr. Holmes prior to the stress of the jail or the stress of the charges, is that something that would have been relevant to your assessment?
Yes, potentially writings that were rambling, and I'm sorry, the second term you used?
Philosophical.
Okay. The rambling is what caught my ear more. I would have looked at the quality of the thought and the organization of thought, and it could have suggested also early signs of a psychotic disorder.
Okay, so are these examples of other history that you would have taken into account when deciding whether what you saw was psychosis based on an illness versus just psychotic symptoms in the present moment?
Yes.
Does the presence of delirium obviate the psychosis? Does one cancel out the other?
No.
Can they coexist?
They do, and in fact, the presence of a mental illness sometimes makes delirium more likely.
And I think you explained that earlier about the causes them not to eat or drink sometimes?
Yes.
Do you believe that Mr. Holmes was psychotic when you saw him?
Yes.
Thank you.
Recross.
Dr. Loudermilk, along those lines, if as part of the information that you had at the time that you were looking at him would be knowledge that 2 court-appointed doctors evaluated the defendant and found him sane, would that be pertinent to your evaluation as well?
Objection, relevance.
Overruled.
Your Honor, can we approach?
Yes. All right, the objection is sustained, so I changed my mind, but Ms. Pearson, you may proceed as we talked about at the bench.
Dr. Loudermilk, if you had also had an opportunity to read writings that talked about planning and deliberation and considering and rejecting different targets for your crime, would that be something that you would have considered in deciding whether this is a psychosis brought on by mental illness or by now sitting in jail for a long time?
You can be psychotic and still plan. That's more of a legal question than a clinical one.
And if you found the defendant was able to participate in his life and had a relationship with a girlfriend and could go to the gym and go out in public and do all of those things during the time of the crime, would those be things that you would want to consider when you're trying to determine whether or not this person was psychotic or prodromal, 5 months earlier?
So forgive me, I'm not trying to determine if he was psychotic 5 months earlier, but if I knew that there were symptoms present, if I'd been given evidence of symptoms present that were emerging over time, I would take that into account at the time I saw him. Prodromal symptoms can be rather subtle. Certain illnesses often occur when people are of college age. They are functioning. They may or may not be in relationships. So there can be lower level symptoms that are present despite people doing multiple things in life.
Fair to say you weren't given any history about what was occurring at the time of the offense almost 5 months earlier, correct? Or in the months prior to that?
Correct.
Or even in the months after that, from July, August, September, October, even the first part of November, you got no information about the defendant during any of that time, correct?
Correct.
So your opinions were based strictly on what you saw on one day for 20 minutes after the defendant had been in the hospital for 3 days in the middle of November, correct?
Partially. My opinions were based in part on my direct contact with him and a review of the information we had, which I believe started on Thursday.
And you would agree that you don't have any information about when any of his behaviors started to change and how far back that goes?
Correct.
Thank you.
All right, there did not appear to be any questions from the jury. We're going to go ahead. Oh, there may be a question from the jury. Okay.
Also, Your Honor, I was hoping to publish the exhibit too.
Okay, we're going to publish the exhibit. Do you want to hold off on the jury questions until the exhibit is published?
Perhaps Ms. Pearson and I and you can talk about the ones that are submitted, and then we can let them read and see if there are any additional.
Okay, that's fine. Why don't you hand those to my staff, please? Doctor, you'll have to stay here for just a moment, okay? Thank you. Would counsel please approach? All right, the record should reflect that we just finished publishing Exhibit D-TR-82. All right, Doctor, the jury has submitted a couple of questions that, based on the rules of evidence and other applicable rules of law, I find are appropriate. The first question is, did you have to get permission from anyone to give Mr. Holmes medication? And if so, who did you have to get permission from?
No, we did not need to get permission from anybody. He was accepting the medications. There are circumstances when medications can be given against somebody's will if they are not accepting them.
All right, the next question is, can a person who's being properly treated and medicated have a psychotic break and delusions?
Yes.
The next question is, Ms. Brady asked about a family history of mental illness, and 2 doctors indicated mental illness. Would that change your opinion if the patient had then had the added stressor of committing this crime? Could that have caused a psychotic break? So it appears to be a 2-part question, and I'm happy to read it again.
If you don't mind, thank you.
All right, maybe I'll ask it one at a time. The first part is, Ms. Brady asked about a family history of mental illness. 2 doctors indicated mental illness. Would that change your opinion?
No.
The next part is, if the patient had then had the added stressor of committing this crime, could that have caused a psychotic break?
It could be, yes, a significant stressor can result in a psychotic break, so the, say, first full appearance of an illness.
All right, any follow-up questions from you, Ms. Brady?
Briefly, so following up on those 2 questions that were asked there, the first one was whether knowing a family history of mental illness and prior to psychiatrists determining there was mental illness, would that affect your opinion? Can you explain to the jury what that does for your opinion?
It strengthens it. Again, it appeared that there was a psychotic disorder there, and so knowing that there had been earlier concerns or symptoms and a family history just adds to the likelihood that there is a psychotic disorder.
So when you say disorder, you're talking about an illness, right? And then, was it like you said before, and then a stressor can cause it to exacerbate into the symptoms that you saw?
Yes.
The symptoms you were seeing in large part appeared to be what are called positive symptoms?
Yes.
Can you explain to the jury the difference between...
Objection, Your Honor. It goes beyond the scope.
Ms. Brady, I think it does.
Okay, can I have just a moment?
Yes.
And prior to the psychotic break you described could be that prodrome stage you were describing before.
A prodrome state can occur for weeks to months to sometimes even years prior. It can be subtle findings. It can be people withdrawing, people developing odd beliefs, but that were not fully delusions, for instance. Multiple things can be prodromal symptoms, but again, they can last for weeks to months and kind of build up.
And escalate up to... Thank you.
Any follow-up questions from you, Ms. Pearson?
People who are in a prodromal state can function in society fine, right?
Typically.
And nobody would even be aware that there was anything going on with them because of their behaviors?
People tend to notice, so by having prodromal symptoms, you're demonstrating something. And so something is noticed. Commonly, people will start to withdraw from relationships. They will have some signs. So you're noticing something. You just can't quite put your finger on what it is yet.
But by and large, people are functioning okay at that stage?
Yes.
Thank you.
May this witness be released from our subpoena?
Yes, sir.
Any objection?
No, Your Honor.
All right, thank you.
Thank you.
All right, members of the jury, it's about 12:22. Today is a day when we have to finish a little early, so let's plan to end at 4:45 today. no later than 4:45. In light of that, is everyone okay taking a shortened lunch break, say an hour and about 10 minutes, so I'll have you back at the usual 1:30, even though it's already 12:22? Does that present a problem for anyone? All right, and then let's plan on taking a shortened lunch break the rest of this week if we can. We're still ahead of schedule, but I want to make sure I keep us ahead of schedule, okay? All right, thank you. Please make sure you comply with all my admonishments during the break. The record should reflect the jury has exited the courtroom. Let's go ahead and take our lunch break, and I'll see everyone back here at 1:30. The court will be in recess. Thank you.